Hello, and welcome to the Outdoorsy Diva podcast. I'm your host, Lauren, the Outdoorsy Diva. Thanks for joining. All right, adventurers, so happy to have you back on the podcast today. We have a really special guest. This is an award-winning travel blogger, the creator of The Sophisticated Life, best-selling author of a travel guide series on Amazon. She's one of the 2020 O Magazine Insiders. She's also a really dear friend and somebody that I really look up to. But when she's not jet setting somewhere fabulous, she is busy treating patients as a physician. I don't know how she does it, but she's like a superwoman. So I'm so happy to welcome Dr. Nadeen White to the show.
Oh,
Welcome.
thank you so much for having me. What a wonderful introduction. Thank you.
So I have invited Nadeen to the podcast to talk about a not so sexy subject. We are going to talk about this coronavirus that is all over our media, like all day, every day, all over the world.
Right.
So I invited Nadeen because, on a personal note, I had an upcoming trip planned next month to Tokyo, Japan. And as you know, the coronavirus is heavily affecting China and some additional countries kind of in that region of the world. So we were talking personally, and I kind of had some concerns. And Nadine knows other people who had concerns. So she decided to do a Facebook Live and just kind of share some information and her perspective, as somebody on the front lines, as a medical professional, in what she knew and, just some things to consider. So I thought, what a great thing to do, have her on the podcast. Let's talk about it, get some questions answered, get some resources for people.
Yes.
So I guess first for people, could you just give us a little background on you, professionally? I don't
Sure.
know as much about you as a physician.
Yes, of course. So I do call myself a blogger by day and physician by night. I have been practicing medicine since I finished residency in 1999, so over 20 years. And for about the past 12 years, I've been doing hospital medicine. So I work at a children's hospital here in Atlanta. I take care of patients from newborns to age 21. So I see as many adults and young adults as I do children. And yeah, it's been an amazing experience. Like you mentioned, I'm on the front line of seeing a lot of these illnesses that take over our society at times, such as influenza right now. We're very busy with that. So I admit patients from the emergency room, see patients there. So we always get a lot of updates from our local state department, health departments, and obviously our administrators keep us up to date as to what's going on worldwide, because being in Atlanta, which has the busiest airport in the world, we see patients from all over the world come through Atlanta, or they go and visit family in other places of the world and then they come back to Atlanta. So we're a huge hub for international travelers and residents. So we try and stay very up to date as to what's going on. So that is my full-time job. And then a few years ago, I decided to start the Sophisticated Life blog, and just detailing and giving people a perspective about what it's like to travel all over the world, and destination guides and food and wine guides. And so that's become a huge passion of mine that I have explored. And like you mentioned, this year I'm serving as a O Magazine brand ambassador. So that's exciting.
Hey.
Yeah, very exciting. And last year I put out the series of Amazon travel ebooks and became a speaker for the first time at Audacity Fest in September. So yeah, I'm excited. It's led to a lot of great opportunities. And there have been times, like when Zika virus was big in the news about 2 years ago, that I have combined both of my passions and written about, travel, medical related topics. So when this came up, I thought, well, it's a great opportunity once again to kind of share information and share facts and resources with people, because as we know, especially in travel groups, a lot of rumors and gossip and misinformation can get out there. And I think it's really important for people to know, the facts about this.
Absolutely. The hysteria in some of these groups is insane.
Yes, yes. Oh my gosh. So, yeah,
Okay, so a little background for our listeners on, what the coronavirus is
yeah.
and, what this strand is, because I thought that was really interesting from your Facebook Live.
Yes, yes. So a lot of people don't realize that coronavirus has been around for ages. It's not that virus family. So has been around for a very long time. We actually test for 4 strains of it in my hospital because they do cause what we call bronchiolitis in babies, which is a viral infection of the lungs, can cause common cold symptoms with fever, can even cause some nausea and vomiting. So within, you look at coronavirus kind of like a headache, a family, kind of like influenza, where people may have heard of influenza A or B. There's different strains of all viruses, and they're identified usually by numbers or letters or the year that they're first diagnosed. So, although people may not have paid attention or have heard about it before, it's a known virus that's been out there. People may have heard of, though, SARS, for example. That was a big scare back in 2003. That was caused by coronavirus. So I realize some people don't know that. Another one was MERS, MERS. That was Middle East Respiratory Syndrome, and that was also caused by coronavirus. So they're known to cause these respiratory illnesses. Most of the time, they're mild. About 20% of the time, including this current coronavirus, it can become, you can have severe symptoms that can lead to things like pneumonia, unfortunately, respiratory failure where your lungs fail, kidney failure, and unfortunately, death. This particular coronavirus, which has had several names, now it's called COVID 19. It's also called SARS coronavirus 2, just because it's behaving a lot like the SARS from 2003. Um, but the 2019 is important because it was first diagnosed December of 2019 in central China. And it's a new strain of coronavirus, meaning this is the first time this coronavirus has been identified in humans. So basically, what they do is they can check genetic DNA of the virus. And this particular virus, looking at the pattern, the nucleic acid, this is a new strain of coronavirus that's never been seen in humans before.
Gotcha. And I actually I didn't pick up on the 19 part, so that it's the
Oh,
year.
yes. Yes, absolutely. So it was first diagnosed. There were a cluster of patients in Wuhan, China, in the Hubei province of China. Wuhan is the capital. And there were a cluster of patients that developed really severe pneumonia. And actually, the whistleblower doctor that first realized there was a commonality between them, he passed away from the virus. But so looking at these patients that all had similar symptoms, they started doing some testing because they realized they were all associated with live animal markets and seafood markets in that area of China. And that's how they first developed and realized that they all were suffering from this new virus. So that was in December of 2019.
Okay. And so one of the rumors that I know was going around was that this came from people eating bats. Can you speak to that?
Sure. So these viruses are known to live in animals, and so their primary habitat is animals. And so they go from animals to humans. And back in when SARS happened, we know that that virus lived in bats. Then they bit cats, and then the cats transmitted it to humans. And that could be just from close contact with the humans or the cats scratching or biting humans. This virus, what they think happened, they still don't know the exact animal vector. But what they think happened is they still think it came from bats originally. But what can happen is the animals have the virus, and then you can get it from the animals just from being around the animals all the time, like living with the animals. You can get it from eating uncooked animals. You can get it from handling the animals and not washing your hands properly and then touching your nose or mouth. Sometimes these animals are used for medicine. So they use like the skin or parts of the animal and they use it for medicine, and you intake the medicine and then you can get it that way. So there's several ways that it can go from humans to animals. But yes, it's primarily in animals, and then it can spread to humans. Then what happens is once it's in humans, it has to be able to, for it to become dangerous, it has to spread from human to human. That becomes a concern. And we call that person to person transmission. And that usually takes place, like the virus mutates once it's in a human and allows it to then spread from person to person. So that is kind of how it's spread usually. And this is specific usually for coronavirus. It's usually an animal vector that allows it to go from an animal into a human and then from human to human. So right now they think there's this animal that they're looking at that's a mammal that is highly trafficked in that area. And if anybody
Oh.
looks it up, it's pretty yucky looking. It's called a pangolin, and it's an ant-eating endangered mammal that's kind of scaly, and it's imported into Chinese market and used for food and medicines. And so what they're looking at is like the scaly part sometimes is used to in medicines, and then people obviously take the medicine. So when they look at the genetic sequences of that animal right now, it's a 99% match to this new coronavirus. So that they aren't saying it's definitely that yet, but that's the closest match they have found from these markets to this new virus. So they still think that bats may have been the original source, and then they may have then transmitted it to this animal, and then that animal, and then that into humans. So it may have still been an intermediate animal vector, so to speak. But that's what so far that's the closest that they've come up with where it could have come from.
Oh, wow. That's really interesting. I mean, I know this
Yeah.
is real life, but it also sounds like a movie.
Yes, like Outbreak. My husband said that last
Right.
night. He said, "This sounds like Outbreak." I mean, it really is interesting, and people don't realize, I think, how intelligent and smart, I guess I could say, these viruses and bacteria are. They can mutate to survive and to spread between species. It's really fascinating.
And so speaking of that specifically, how they mutate and how they change and survive, what's making this one seem like so different? And what I mean is like, the medical director that you mentioned, there was another guy in the news, another that I read about was a doctor and his whole family. So it
Yeah.
seems like seemingly healthy people, not just, children and elderly, are succumbing to the disease. Do they understand yet why that is?
No, so from all they can tell so far from statistics, and it's definitely affecting older people more than younger people. There haven't actually been any deaths in anyone 9 years or younger, which is
Okay.
interesting to me because, for instance, like the flu virus, that heavily affects babies and children. So right now, the highest mortality rates have been like people 80 and over, and then it kind of drops a little after that, each age group. But you're right. Healthy people, people who are completely healthy, medical professionals who obviously do, wear protective equipment, have been contracting it and have unfortunately have been dying. So they're still doing kind of research, obviously, to find out why the mortality rate has been so high, even in healthy, normal people. The other thing they realize is it's highest in that capital in Wuhan and the Hubei province. The death rate is higher there than it is in other countries that have people who are positive for it. So whether it's that particular strain is even like just a more deadly strain in Hubei and Wuhan province is something I think they need to look into, because it's definitely the death rate there is the highest out of any other subgroup of population outside of that province in terms of people contracting it and dying from it. Um, yeah,
And
so it's
and
scary in that area.
and do we know, outside of China, how many other countries are affected, or the next countries with the highest cases?
Yes. So, in terms of outside of China, there have been, and I don't want to say only because six is still high, but considering there have been over 2,000 deaths, there have been only about six outside of China, in Japan, Taiwan, France, Hong Kong, and the Philippines. And in terms of the cases, right now, Japan and Singapore have the most cases outside of China and Hong Kong, not including the Diamond Princess ship that
Okay,
has
so
had
that's
a
not
lot.
including the ship. They have other
Yeah,
cases reported.
the ship has had like 545 cases, which is insane. So they were docked off the coast of Japan. But in terms of Japan itself, there have been 68 confirmed cases. Singapore has 81 confirmed cases. Hong Kong right now has 62 confirmed cases and 2 deaths. Like I said, there was 1 death in Japan, a death in the Philippines, a death in Taiwan and France. So the death rate actually, and I hate make it sound terrible, it's worse obviously in China. Outside of China, it's pretty low.
Gotcha.
Yeah.
And for listeners who may not have been abreast of what we're talking about when we say the Diamond Princess, so there was a cruise ship
Yes.
that was trying to, disembark basically, and they are docked at Japan. They are quarantined, not allowed to leave the ship with all of these people. I followed some of them have actually been on Twitter talking about the experience. Right now, there's actually countries, including the United States, trying to evacuate some of their citizens
Yes.
from the ship because basically they're stuck on this ship. It's a breeding ground, and eventually everybody's going to have it.
That's exactly right. And they actually officially ended the quarantine, I believe, yesterday. But you're right. Before
Okay.
quarantine ended, United States is one of the countries, and other countries were going and arranging for their citizens to get back because you're right, it wasn't working. I mean, they had allowed passengers who did not have like windows or balconies to leave their cabin, obviously, every day. They were supposed to wear a mask. They were supposed to not engage with other passengers. But then you have the crew that were still serving everyone. They were still in common areas. They had to serve the food every day. So there was no way to keep it at bay there because people still were around each other, and crew members were going, serving passenger to passenger. So, like I said, I mean, it was 545 cases as of yesterday that developed on there. So there was actually, in terms of the United States passengers, 14 were positive.
Oh,
So that's
wow.
still pretty low considering, how many people ended up getting it. And so the passengers that were brought back to the United States, they found out like on real route back that there was like a few of them that were positive. And so they isolated them on the plane. And then once they got to the US, they have to go into another 14-day quarantine. Can you imagine? After
Wow.
you've just been quarantined.
What an ordeal.
Yeah, especially if they have no symptoms, which is why they allowed them to fly on the plane back with the other people that were negative. But they now have to go into additional 14 days because they tested positive in the past few days. So yeah, so that was about 14 Americans from the cruise ship that were positive, which brings the total U.S. Infection rate to like 29 people, which
Okay.
again, when we talked about this, I did a Facebook Live Thursday, and between Thursday and today, all the numbers have jumped up except for how many people in the United States have it. So that remained at 15. So there has not been a lot of person to person transmission in the United States at all. I think there's only been 2. Everybody else had come from China that were positive. And then now these 14 cruise ship passengers, obviously they got it from being on the cruise ship. So there hasn't been just this person to person spread in the United States where our numbers are going up and up and up. So I think that's important for people to know.
And can we talk about, I guess, kind of the difference with coronavirus and the flu numbers wise and probability wise? I mean, is the
Right.
hysteria really warranted, or are we
Right.
more likely to
So
catch the flu?
yeah, so in America, I think it's important to differentiate between the US and obviously if you're in mainland China. So
Right.
if you're in the United States, the risk of getting infected with coronavirus is low. The risk of getting the flu is high. In terms of actual numbers, there have been 14,000, this went up since last week also. There were 14,000 deaths in America, of Americans alone, because of the flu this past season so far. 92 of those were children. Um, and again, there have been no coronavirus deaths in the US, and there have only been 6 coronavirus deaths outside of China. There have been about 19 million people Americans that have been sick from the flu this season, and 250,000 that have been hospitalized. And again, the difference with the flu is there's obviously the flu vaccine that can help you
Right.
prevent you getting the flu. And even if you get the flu, your symptoms aren't as bad as if you had not gotten it. It reduces symptoms by 40 to 60%. Now, if you talk about in China, there are over, like I mentioned, over 2,000 deaths so far. There's over 75,000 people infected. When you do the calculation, the death rate of coronavirus in China is higher. It's about 2%. Um,
Okay.
the death rate of the flu in the United States, just because there's like millions of people who have gotten sick from the flu. And like I mentioned, there have been like 14,000 deaths. That number is only like zero point 0.1 to 0.2%. So the Chinese Center for Disease Control put something out in the past few days talking about how it's more deadly and then the flu. And I think people started getting nervous about that. But yes, that's in mainland China and specifically in the Hubei province. If you're talking about in America, then you have to be more worried about the flu. Absolutely, more worried about the flu.
And so, for those of us who have, or in my case, had travel plans, so for
Sure.
me, I had kind of resolved that I'm just going to pay attention, watch it, see how things go. I still had plenty of time and I did have travel insurance. So, I was still planning
Right.
to go. And as of yesterday, my flight was canceled. I was actually
Wow.
flying on a Japanese based airline. And in an effort to, they have a whole notice on their website, in an effort to kind of combat efforts, lower their exposure for their employees and for, the country. They cut back on their flight service for various locations. I wasn't flying through China
Right.
at all, but
Wow.
my flight that was through Houston just happened to be one of the ones that got nixed. So I just
Wow.
took that as divine intervention.
Right. Right.
Japan will be there. Um,
Yes. Yes, it will, but that is I mean, when you mentioned that to me, I was surprised. I know for sure that major airlines in the United States, United, Delta, American Airlines are not flying to China. They're not even flying to Hong Kong, so those flights have been canceled through, like, the end of, March. So, yeah, I was surprised to hear that, but at the same time, I also saw that Japan, they had canceled a marathon. Well, they didn't cancel
mm,
the marathon in Tokyo, but non, professional runners, there are no longer going to be able to run in that marathon in Tokyo. They had a confirmed case there, and I think they're a bit nervous about the mass of people that were coming for the marathon. So I did see that. I happened to check because I wanted to mention this to people traveling. So if we talked about the United States and the low risk here, but if you are traveling abroad, especially to Asia, definitely check the travel.state.gov website and the cdc.gov, because they have warnings from level 1 through 4 on the State Department website and 1 through 3 on the CDC website, letting you know the risks in terms of going to these countries in Asia. So I checked again last night, for instance, and Japan was still just a level 1, which means just exercise usual precautions when you're traveling. Hong Kong is a level 2. So I think, obviously you should also check with your airlines and your hotels, tour companies, if you are going to be traveling to Asia, but definitely check these websites to see what the travel advisories are for the place you're going to.
And so right now, just for traveling, I would say in that region and just in general, right? Because
Right.
people
That's what
end
I
up
was going to
everywhere. What's kind of the best practice to protect yourself from this virus, and others?
Right. So, I mean, even in the US, whichever virus, in terms of just preventing getting sick, especially this time of year, definitely hand washing is very important. Please use soap. Please wash your hands under the water for 20 to 30 seconds. Using hand sanitizers. Try not to touch your face a lot, touching your nose area, your mouth area. If you're coughing or sneezing, try and use a tissue versus your hand. Dispose of that tissue into a closed container, because if you sneeze or cough in your hand, then you don't wash or sanitize your hand, you're just going to be spreading that around. If you work in common areas, or again, if you're traveling trains, planes, automobiles, and it's common usage, I always recommend carrying Lysol wipes, any kind of brand of disinfectant wipes, wiping down that entire area. We know that this virus and other similar viruses can last for days on inanimate objects. So it's important, like when you on a cruise ship or in a hotel, I wipe down everything, the remote, the the phone. I don't use the phones in there, to be honest with you. But if you are, make sure you wipe all of that down. And that's just in general in terms of being around anyone who's sick. So that's, I think, what's scary for people if they get stuck in a confined place and they're next to someone who's sick. All the airlines now have procedures that they're supposed to follow. If somebody reports that they're feeling sick, feeling like they have a fever, if you should report them as well. If you notice that somebody's coughing, sneezing, obviously sick, has no mask on, and we could definitely talk about masks as well. But those are the things that you should do in terms of avoiding being around people that are sick. Sometimes it's hard, but I would reconsider things like, I know a lot of people share rooms, stay in hostels when they travel. It's just
Hmm.
something to really consider. I know that in China, they've shut down Disneyland in Shanghai, because, as we know, places like that are just a breeding ground. When we were on a cruise ship recently, we actually got sick. We didn't get, you know, norovirus or coronavirus, but my husband developed a pretty bad cold that he passed on to me. And this was on a warm weather Caribbean cruise, and I'm asking him, like, how did you get sick? Like, I don't think he was as cautious as I am. I won't even touch the bathroom doors. I use tissues. I don't touch the railings on the cruise ships. I use hand sanitizer tons of, constantly, especially with the buffets there. So I think people just need to be really aware and conscious of that when you're around large groups of people. I do know masks has, I'm sure everyone has seen people walking around China and Asia with masks on their face. They actually are requiring it in two provinces in China right now, just to try and reduce the spread of the virus. And there's two types that people probably have seen. One are the surgical masks that have that name because surgeons use them a lot. And then there's the N95 respiratory mask, and they have different functions. So I know for me, and for when surgeons obviously use it, the reason why we use those masks is to prevent any viruses or anything we have in our respiratory system passed on to a patient. So if you're doing, surgery on a patient, you don't want to cough and then your viruses or bacteria get into that patient's body, obviously. So they always remain sterile and wear the mask. Whether I'm sick or not, I actually wear a mask at the hospital because, especially this time of year, I've had one too many kids cough in my face,
Ah,
throw up on me, spit on me. But technically, those surgical masks are to prevent you from spreading your germs to other people. So if somebody is sick with the coronavirus or just sick in general with a cold, it is good for them to have on those masks because when they cough or sneeze, it kind of reduces how much of it gets out into the air and into the public, how much of it can land on objects around them. The N95 respiratory masks, they are more to protect you from inhaling germs and viruses. So if you're wearing that N95 mask and you're around somebody who is sick or has coronavirus, it reduces the chance that you will actually inhale any of those particles or those viruses. So that mask more protects the person who is wearing it from, like the healthy person who's wearing it, to breathe in any of those contaminants around them. It's not 100%. They think that this coronavirus, the particles are so small that they can even get through those N95 masks. So that's why I tell people, even either mask that you're wearing, don't get like this false sense of security. Don't put your hands underneath the mask to like rub on your nose or eat or anything like that. If the mask get really wet from your sneezing or runny nose, then it's good to change them or take them off. So, just, and still wash your hands and use sanitizers all the time. I literally wear a mask, wear gloves, take off my mask and my gloves, and still put sanitizer on, you know? So, and I've still gotten sick, unfortunately. So, I mean, it's just, I don't want people to get a false sense of security, like, oh, I have a mask on, but I'm on the subway touching, the
right.
cars and handles, and I don't use sanitizer, wash my hands afterwards, and I had on a mask, so I'm good.
Now,
Um,
is that practical, for like traveling, flying on a plane, for us to even
I
want to get that other, what's the other
and
mask?
and 95 masks, I will tell
Yeah.
you, they're not easy to use or put on. They're uncomfortable. When I have worn them, it's hard to breathe in them. So I would say people who have like asthma, for instance, would have a
Mhm.
hard time, or if you have any kind of, even, it sounds crazy, but if you get claustrophobic, you will have a hard time keeping those masks. Because the whole point of those masks is to have a tight fit on your face so that particles can't get in. So if they're not, either masks are not routinely recommended at this point. It is recommended if you are sick to wear a mask so that you're not like contaminating everybody around you. But for healthy people, there's no current recommendation for you to use either one. I say that to say, though, I understand, especially from my Facebook Live, for people who are flying on, have long haul flights, let's say they're going through Asia or they're going to Asia, that they may want to have a mask on them in case they get stuck next to somebody who's sick and coughing, and if you have a chronic illness, like if you do have asthma or anything similar, or you don't have a strong immune system, or you take care of people who are elderly, you may want to be even extra cautious to not get sick. So I can
Mhm.
understand kind of having that. I will still say, though, that person who is sick should be reported, and it sounds horrible, but they should be, to make sure that the flight attendants or wherever you are, even if you're in a hotel or hostel and somebody's obviously sick, so that they can be checked out, they can be isolated, they can be put in a mask.
Listen, I'm flying next week for my birthday trip to go to Asheville. And it is a short flight, but my head will be on you. You bet not so much as sniff.
Right, exactly. Right.
And I'm gonna be looking like, what's your temperature? How you feeling? What
Right.
symptoms you have?
And it's good you mentioned the temperature, because I've been really impressed to find out places like Panama, I think in the Middle East, I won't just randomly say the country, but again, from that Facebook Live, I learned that there's a lot of countries that are taking the temperatures, using thermal scanners to see if people have elevated body temperature, having people fill out the health screens, because they don't want anyone entering their country that may have it or be sick. I mean, smaller countries that don't have a lot of resources or money, it would be like just detrimental to them if
Right.
they were to, have anybody come in infected and spread that around. So I think that's a really great initiative that countries are doing to make sure people aren't always honest. They check off no, 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 no. But if you get out there and you have a fever, then they're going to take you away, isolate you, have you checked out before they would let you enter the country.
And so, why do you think this particular one has just created such a media panic?
Yes, and it's interesting because I spoke to a friend of mine in Thailand, and he was surprised I even did the Facebook Live. He was like, "People are really worried about that over there, and no one cares over here." And he lives in
Oh, wow.
yeah, which is surprising because when you watch the news, again, you see they always just show, and it's mostly China, but they show people wearing the mask. And there was even a picture, I think, of a cat that had the mask on, which I thought was hilarious. So I was surprised when he told me that. And I think they're more used to these, the viruses are usually, these type of viruses usually just pop up over there. So people may be more used to it there. But I really think it's because it's new, first of all. So when something's new and unknown, there's no treatment for it. There's no current vaccine for it. So I think that makes it really scary. And like we mentioned before, they're completely like healthy people, healthy adults who are contracting it and dying. In the beginning, they tried to keep it hush hush. I think that was a mistake because then all these people that were sick didn't know that they may have had it, and then they spread it to
Mm,
other people. They did these home quarantines in China that we know, just kind of like the cruise ship, didn't work because whole family members spread it to each other, and there's like the whole family of a movie director that died. um, and so I can't imagine how tough it must be for the Chinese officials and health professionals to try and figure out how to contain this. But I think that's what's scary. I think what's scary to the public is it's so new and unknown. The idea that that could get out from
right.
that area, and then we could have like an epidemic here in the US or in another country. I think that's what's scary. If you're on a cruise ship just on a vacation for a few months, and then now you're quarantined and you may have a deadly virus, it is scary,
Right.
scary. And so all these Americans coming back and being quarantined have a lot of Americans that may not even be in those areas kind of nervous about, bringing these people back to America, but they're being monitored for sure and being quarantined even here, to try and make sure that we don't have that issue, that they have over there.
I mean, and I was even concerned about that for my trip. One of the highlights of that trip for me is getting to go to Tokyo Disney and Disney Sea. And
Oh,
I was
cute.
already kind of reconsidering just my itinerary if I did still go, just because,
Right,
like you said, those places are such breeding grounds. And with it being this weird window, right, and we really don't know what's going to happen, the cases are just starting to show up in
right.
Tokyo, in Japan. So it was kind of like, do I want to put
Yes,
myself in situations where I'm around so many people and touching
right,
things and sitting on a ride and blah, blah, blah. So I definitely, and I am asthmatic. It's usually
right,
seasonal and allergy driven.
right.
But things that are respiratory definitely concern me. So I
Absolutely.
for resources for travelers with concerns or wanting to change their plans, I think one big thing to make sure that we mention is you definitely want to make sure that you have travel insurance.
Yes,
Um,
yes.
I use World Nomad. I've also used what's the other one? Allianz
Yep, that's who I have for my annual insurance.
for an annual one. I had looked at like World Nomad. A lot of the travel insurance, the ones who are dedicated to this, I'm not talking about like your supplemental insurance through a credit card or something like that. I feel
Right.
like those tend to be a little less comprehensive, but the true, travel insurance type of companies, they're very aware of the concern and seem to be offering quite a bit of flexibility,
Right.
in terms of working with you regarding your trip. As an
Yes.
asthmatic, I had already made up in my mind that, okay, game time decision. If I decide, within, 2 weeks before and the travel insurance won't do it, I'll just go to my doctor and she'll
Right.
say, she has respiratory issues, it's compromised, blah, 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 and, get me what I need to get it
Yes.
covered. And
Mhm.
so that's another option for people to consider, especially if you have any kind of health issues that you feel might make
Absolutely.
more susceptible.
Yes.
And then a lot of the airlines, like the Japanese airline that I was flying, they were already offering to change flights and allow
Oh,
for
that's great.
cancellations. And that information was on their website. My ticket was actually through a third party travel agent. And so with the cancellation and everything, they also were fully willing to make whatever changes. So in my case, I'm just getting the refund because that's such a big trip. I don't
Oh, no, that's
commit
great.
to just another date just off the top of my head. I'll just replan it later.
No, that's great that they did that. That's awesome.
But
That is
just for people to know, if you do have plans in that region of the world, don't wait. Like, you need to go ahead and get the travel insurance. You don't want to be in a situation where, that level does change the threat level, and then you try to get insurance after the fact, and they're going to be looking at you like,
right.
no,
Right.
you already knew there was an issue over there. So can't help you. Like, your insurance companies are in it for them more than you. So
Right.
definitely just be proactive about that so that in whatever happens, you're covered and you have some options and peace of mind. In addition
Absolutely.
to, you mentioned the State Department website for people to check the threat levels and the CDC. Um,
Yes, definitely. And they can also travel.state.gov is where I check for travel advisories. And then the cdc.gov has a little bit more like medical health related information. But another thing people can do on the State Department website is enrolled in the STEP program, the Smart Traveler Enrollment Program. And with that, they'll receive alerts as to what's going on. And there you check off which destination you're going to, and you'll get alerts as to what's going on there, and it also lets you put in the date of when you'll be there. So let's say you're in the country and there's something that happens, there's an emergency, they know that you're there and how to contact you. So I do fill that out whenever I'm going to, even before this, when I'm traveling internationally, just so the embassies and the State Department know that okay, I'm an American and I'm in this country and they're evacuating all Americans.
Yep,
So,
that's one that I do every time I leave the country as
yes,
well. That is advice I have given on this podcast before, and
yes.
we will drop all of those links that Nadine mentioned. They'll be in the show notes, as well as a link to her full Facebook Live
Oh,
video
thank you.
and links to the blog, so you can get access to all this information and all the other great, more fun topics that Nadine covers.
Yes, yes, right? You know
We'll
what?
have to have her back to talk about something more fun, like, wine or something.
Right, exactly, exactly. No, but I think it's great. Thank you for having me. I mean, it's great to get this out there to as many people as possible, and I think it'll be really helpful for people who have travel plans coming up.
I do. I really, really appreciate you taking the time to share with us. And quick disclaimer for everyone out there, this is just general advice. This is Nadine's opinion, but this is not medical advice. And you should definitely check with your own medical practitioner to discuss your personal circumstances and issues.
Absolutely, absolutely, yes. And if you have been to China or Asia or, sick in general, fever, cough, cold, anything like that, trouble breathing, call your doctor, go to your emergency room, but please let them know your travel history before you arrive. Don't sit in the waiting room coughing and sneezing, knowing that you just flew back, or if you've been around someone who's suspected to have had the virus. So just let people know ahead of time before you get there. So again, they can put you in a proper isolation area, put you in the proper mask so that we can kind of try and, contain the spread of that here in the US.
All right. Thank you so much, Nadine. I
You're
think this was
welcome.
super helpful.
Awesome. Awesome. Thanks again for having me.
Thank you so much for listening. I hope that you enjoyed this episode. And if you did, make sure you subscribe to the Outdoorsy Diva podcast. Be sure to check out Misadventures of an Outdoorsy Diva blog on outdoorsydiva.com. You can also keep up with me and my adventures, so check out all of my social channels. Find Outdoorsy Diva on Facebook, Twitter, Instagram, and Pinterest.